In this podcast episode, Dr. Sharon Malone, a board-certified OBGYN and nationally recognized expert in women's health, provides a comprehensive guide on the hormonal journey from puberty through menopause. She unpacks topics such as birth control, perimenopause, fertility changes, PCOS, now also called polyendocrine metabolic syndrome, endometriosis, and menopause, emphasizing the interconnectedness of these stages and the importance of informed healthcare decisions. Dr. Malone also addresses common myths and misinformation, empowering women to advocate for their health with science-backed knowledge. Dr. Malone highlights the revolutionary impact of birth control pills, which allowed women for the first time to reliably control the timing of their families and pursue education and careers. Despite prevalent fears, fueled by social media misinformation, that birth control causes infertility or serious side effects, she reassures that these pills are generally safe, especially for young women, and often provide additional medical benefits. Birth control can ease heavy periods, reduce anemia risk, alleviate severe PMS, and help with painful cramps, including those from suspected endometriosis. Dr. Malone stresses that the small risks of birth control pills are far outweighed by the dangers associated with unintended pregnancy. She encourages finding the right pill formulation, as there are about 20 options with different hormonal combinations to minimize side effects. For those wary of pills, she explains the advantages of long-acting reversible contraception, LARC methods such as IUDs, implants, and injectables, which remove user error and offer highly effective protection, especially for those who want to avoid pregnancy for several years. Regarding natural or rhythm methods, Dr. Malone is clear that they are unreliable for preventing pregnancy, particularly given irregular cycles common in many women. Methods like temperature tracking or fertility apps can be helpful for understanding one's cycle retrospectively or when trying to conceive, but are poor contraception tools. She warns against the misconception that going off hormonal birth control preserves fertility, calling it a dangerous myth. She points out that sperm can live up to 72 hours in the reproductive tract, making timing-based methods risky. Dr. Malone also contrasts the relative safety of birth control pills with pregnancy, noting, for example, that pregnancy increases blood clot risk far more than contraceptive pills do. Ultimately, women should make contraception choices based on science, not fear or misinformation. Dr. Malone discusses the evolving terminology from polycystic ovarian disease to polycystic ovarian syndrome, and now to polyendocrine metabolic syndrome, POMS, reflecting its complex hormonal and metabolic nature. PCOS is characterized primarily by irregular ovulation due to multiple eggs developing, but none fully ovulating, leading to hormonal imbalances. Women with PCOS commonly experience androgen excess, resulting in symptoms such as acne, facial and body hair growth, hair thinning or loss, irregular cycles, weight gain, and insulin resistance. While ultrasound may reveal multiple ovarian follicles, this is not a necessary criterion for diagnosis. Dr. Malone emphasizes the need for more research into causes and treatments, as current therapies mainly address symptoms. The syndrome can affect fertility due to infrequent ovulation, but can often be managed with medications for ovulation induction. Endometriosis, affecting about 1 in 10 women, involves uterine lining tissue growing outside the uterus, commonly around ovaries, abdominal cavity, bladder, or bowel. This ectopic tissue responds monthly to hormonal signals, causing chronic inflammation, scarring, and often severe pain. Symptoms include painful periods, painful intercourse, and bowel or bladder problems depending on lesion location, which complicates diagnosis as symptoms mimic other conditions. Many women endure pain for years before diagnosis, as imaging rarely detects the tiny implants. Definitive diagnosis usually requires laparoscopic surgery. Endometriosis is a leading cause of infertility and greatly impacts quality of life. Dr. Malone stresses the importance of awareness and prompt evaluation, especially in women with a family history of the disease. Dr. Malone explains that peak fertility occurs in the late teens through the 20s, with only gradual decline into the early 30s. From ages 35 to 40, fertility declines more rapidly due to diminishing egg quantity and quality, with further acceleration into the early 40s. She encourages women to be aware of their family history concerning reproductive health, including the mother's age at menopause and history of conditions like endometriosis or fibroids, as these can predict individual risk. Egg freezing yields best results when done in the late 20s or early 30s, but does not guarantee pregnancy. Freezing embryos, eggs fertilized with sperm, is generally more successful than egg freezing alone. Unexplained infertility remains frustratingly common, with about half of infertility cases tied to male factors, underscoring the importance of evaluating both partners. Perimenopause, the transitional period before menopause, can begin 4 to 10 years before the final menstrual period. During perimenopause, hormonal fluctuations cause irregular ovulation and declining fertility, which may start earlier if there is a family history of early menopause. This phase can cause symptoms such as irregular cycles, hot flashes, mood changes, and sleep disturbances, often catching women off guard. Dr. Malone urges women to recognize this stage as a continuous part of their reproductive journey and to seek treatment if symptoms impact quality of life. Menopause marks the permanent end of menstruation, typically around age 51. But Dr. Malone emphasizes it is a life stage, not a singular event, during which women may live 30 to 40 years afterward. The absence of estrogen affects bones, skin, brain, heart, and more. While hot flashes are among the best-known symptoms, they are not benign. Frequent or severe hot flashes may indicate increased cardiovascular risk, especially since they disrupt sleep and contribute to other health issues like hypertension and diabetes. Black women particularly experience more severe and prolonged hot flashes, likely linked to chronic stress and systemic factors such as structural racism. Dr. Malone stresses that hormone replacement therapy is the most effective FDA-approved treatment for menopausal symptoms and prevention of osteoporosis. It restores estrogen levels, improving hot flashes, sleep, mood, and protecting bone density. She refutes misconceptions that hormone therapy must be limited in time, explaining women can safely use it as long as needed under medical supervision. She notes, hormone therapy is more beneficial when started early in the menopausal transition rather than delayed. Current shortages in estrogen patches, a common delivery method, may cause concern, but alternatives such as gels and sprays exist. Dr. Malone clarifies the difference between systemic hormone therapy and vaginal estrogen. Vaginal estrogen is applied locally to treat genitourinary symptoms of menopause, including vaginal dryness, painful intercourse, urinary urgency, and frequent urinary tract infections. It acts only in the genital area without systemic hormonal effects and is an important adjunct even for women on systemic HRT. Topical estrogen products can also help improve skin hydration and collagen, which decline after menopause. Estrogen depletion during menopause accelerates bone loss and alters body composition, reducing muscle and bone mass while increasing fat storage, particularly around the abdomen. This combination raises the risk of osteoporosis and fractures. Dr. Malone advocates for early bone density testing at menopause rather than waiting until age 65, as the 5 years following menopause carry the most rapid bone loss. Estrogen therapy helps prevent osteoporosis, and weight training plays a crucial supportive role by maintaining muscle strength and stimulating bone remodeling. Strong muscles improve balance and protect against falls, reducing fracture risk. Maintaining bone and muscle health is critical for independence and quality of life as women age. Dr. Malone highlights the importance of women advocating for their health with evidence-based information and open dialogue with their healthcare providers. She encourages asking 2 key questions about hormone therapy. What are the benefits, and what are the risks if I do not take it? Recognizing menopause as an inevitable but manageable life stage allows women to take control of their well-being and enjoy good health in later life. Dr. Malone emphasizes that with proper care, women can feel better, be more active, and thrive well beyond menopause.